Good morning. My name is Mabel, Jong. Thanks for joining us. You're watching WHCC TV, coming to you live from Washington, D.C., from the World Healthcare Congress. Our next guest is based in Memphis, Tennessee, and she runs a company called, or a consortium called, Connect Healthcare Collaboration. She's the CEO. Welcome to Sally Pace.
Thank you,
Good
Mabel.
morning.
Hi.
Well, let's first get an idea of what Connect Healthcare Collaboration is.
Sure. So we're a community of proven, validated, innovative solutions that are new to the marketplace. So helping plan members and employers look for new ideas, innovative solutions, but yet those that have been vetted and validated.
All right. So you spent your earlier career in finance, and now you're in the business of helping others with healthcare solutions.
Correct.
What were some of the challenges you faced when you first made that switch to a completely different area?
Well, so I'll tell you, actually there were a lot of similarities. The financial industry is not one that experiences rapid change. The healthcare industry is in some ways the same way. Conversely, I was leading teams of people who were the employees whose behavior you were trying to change. And so it's been an interesting mix to see how there is starting to be a shift in the healthcare space at looking at the financials and the impact of the programs that are being implemented for employers.
Right. So what are some of the obstacles for solutions that want to disrupt and be innovative, but there's got to be some barriers when you're starting out?
Sure. Well, I'd say one of the largest barriers is not understanding who the end user is, knowing your audience. In fact, right now, going on in the Grand Ballroom, there's a discussion about social determinants of health. And I think that we, as those of us who are maybe not in the category that I'm about to mention, forget that 35% of all working Americans are classified as working poor. So that means for any employer, about a third of your population could be categorized as working poor. What's important to a broker, to a CFO, to a senior HR leader, maybe something that's very different than what the end user needs and wants. So again, knowing your audience, knowing what kind of value you can bring to all levels within an employer.
Okay, so once there's a clear understanding of who the end user is, then what?
So then you've got to get to work communicating. Communication is key. And I think that permeates any industry, but particularly in healthcare, there's been such a mystification of what it, for example, going to the doctor. Most of us were raised not to question physicians because they knew what they were doing. It was an area that none of us had practiced in, and so therefore they were the experts. Mm-hmm. But you're starting to see a shift in people using their voice and thinking about the long-term consequences. I also think that, again, going back to the financial component, that the status of finances in the U.S. plays into that. I mean, I'm sure everyone is familiar with the fact that the average American has $1,000 in their savings account. High deductible health plans are $1,400, and therefore that means that you could literally be one hospital visit away from devastation. And so those issues, those determinants have to always be at the forefront when you're going in and trying to change somebody's life. Even if you're doing it for good and you have something that can improve their lives, you've got to know your audience and know how to communicate to them.
Well, if these employees are so concerned with other issues that are going on in their lives, how can you ensure employee engagement? This may not be top of mind for them. It's not.
It absolutely is not. Again, what's important to senior leaders is there sometimes is a chasm, and so there were some interesting discussions yesterday about incentives and is that right or is it not? Really, what I think people are starting to see is that you cannot bring a one-size-fits-all program into an employer space, and that's why you're starting to see an entire wall dedicated in the exhibit area of innovative solutions. You've got to find things that meet individuals within a population. So one step to do that is really digging into your data. What are your highest cost drivers? That's generally going to be about 20% or less of the population. Those are the people that need the most help. Spend your time, spend your money, spend your energy there. Start there. Mm-hmm. How do you help those people that need the most help then back away, and then start to help more folks.
Okay, proven methods that you've
Yes.
been able to find?
Yes. So, so it runs the gamut. Anything from cancer detection, helping ensure people are aligned with an ethical PBM. So within a population, you're generally going to have cancers and anomalies. The drug spend has gotten astronomical and out of control. Diabetes, musculoskeletal, orthopedic spend. Those are huge areas of expense for an individual and an employer. But what we see ties it all together is bringing in an advocacy component, a nurse advocacy, a program that is proactive. And this is very different than what you're going to get with a standard TPA, but bring in an advocate that will do outreach, continual outreach, identifying the people that need the most help, and then guiding them. When people are sick, they generally feel scared, alone, and broke. What better way to guide them on their journey than to bring someone in that can help understand what issues they're facing, can help them understand the financial and the physical implications of it, just the doctor visits, the medical maintenance, the drug adherence, guiding them along the way. We all want a friend.
Very good, very good. Sally Pace, so great to talk with you. May I ask how the conference is going so far?
It's been fantastic. It's been high energy, lots of great ideas. I have loved, the theme to me keeps coming up about we're talking about people's lives, whether it's social determinants of health or innovation in some of the hospital platforms like Johns Hopkins that spoke yesterday. It's still all about people, and I love that because we're making a difference in people's lives.
All right, Sally Pace, thank you so much for your time.
Thank you.
And I'm Mabel Jong. Thank you for tuning in. Stay with us, we've got more to come.